Okay, so I want to talk breathing with you. So whether we're trying to relax, pelvic floor breathing, whatever we're trying to do, you have to realise and understand that muscles need to get a full range of movements. Now we have muscles around our diaphragm in the intercostals, we have obviously tummy muscles, we have pelvic floor muscles. So this really is just a little thing to get you thinking, visualising, and think about how you're breathing. Okay, so first of all, posture is really quite important, just nice and upright. And to have hands on is really effective. Eyes closed, hands on, whatever you want to do. So the most important thing to think about is that we need to lengthen muscles. So that bicep is long on a long arm, and then we shorten it and contract it. So we have to get, and we really want to strengthen or relax muscles, we have to get lengthen and shorten. And that applies to the rest of the body, and especially when I'm talking pelvic floor breathing and relaxation breathing. So the most important thing, first of all, is that you're not holding on. We don't want to be gripping around the tummy, gripping the bum, gripping and holding on, because that just causes tightness. And if we were to spend our whole time like that with a shortened bicep curl, then it's just referred pain all the way up, neck ache, headaches or whatever. So the easiest, the best thing for me to explain is really to visualise and think it in 3 points. I always say visualise in your diaphragm first, hands on, and breathe into the diaphragm. Remember, it's 360 breathing. Trying to breathe here. We're not trying to breathe up into our shoulders, and we're not trying to immediately breathe and push out our belly. That's what we want to try and avoid. So the simple little things to start with, and it takes a while to get, so don't just think, oh, I've got it straight away, or oh, I'm never going to get it. It's practice, practice, practice. And just think posture, shoulders are down, and it's easier to do, and I'll show you lying down in a minute, or standing, whatever you want to do. But the most important is shoulders down, relax, chin in, and what you want to do is to sort of visualize. So the first thing, as you're visualizing, and you're visualizing the oxygen coming in through your nose and expanding these rib cage muscles. So if you just think about that first, and then relax and let go, and they shorten. So you breathe, and then they let go. And then you're going to think about, okay, they're going to breathe into, so I sort of just say probably about 60% into the rib cage, breathing into the rib cage, feel that length. And then sort of expands gently into the tummy. You're not pushing out, and then you relax. I sort of say, think and visualize about 60% of the oxygen coming into the rib cage, breathe. And then let that tummy go and feel as if you're getting 20%, 30% coming into that tummy, and then exhale. And again, breathing into the rib cage. Then let the tummy go and feel it coming into the tummy, and then you release it. However, very often you just feel it here. I want you to feel it all just above your pubic bone as well. So it's thinking about 1, 2, and down to here, and that's where it's also going to help with relax and get into the pelvic floor. So basically it's you breathe in for 60% into your tummy a little bit, feel it release and lengthen, and then all the way down here. And often it's easier to actually get hands on and palpate to just above your pubic bone, to try and get that connection, the brain connection. Oh, I've got to let it expand all the way down here. But again, we're not bearing out, because if you bear out and push out, that's called intra-abdominal pressure, and that's just going to push outwards and cause more pressure on the tummy and on the pelvic floor. So if you get your hands on to begin with, start with the breath here and just focus on the ribs. Don't worry about the tummy for a minute, and see what happens, see what you're feeling. So I'm breathing in, and watch my hands, okay? And what I say here is, I say it feels like you're pushing your hands away, pushing into the hands, pushing the hands away, and then let it go. And you can see they're shortening. So now if I just have my fingers together, I breathe. All those muscles are lengthening, and now they're shortening. Okay, so with the breath coming down now, it's going to be 60% here. And then I just let the tummy, and I feel a bit of movement through the tummy as well. And then let it all go. So if you have your hands, you'd notice here. There, and let it go. Okay? And then finally you're thinking, okay, getting it down to the pubic bone, down into that pelvic floor. And you might want to, it's often easier to have the legs apart. I'm probably not sitting in the best position. You might want to sit like this, because often, but make sure you're on your seated bones and nice posture. And you're going to think, having your legs open mean you can release and get length through here as well. So we're re-breathing, close your eyes, and you're just breathing into, and you're thinking, first of all, you're getting the tension here in the rib cage. Then you feel some movement, and then you've got to really think, can I feel some movement down in the lower part of the tummy? And then let it all go and relax. Again, this is all the release and relaxation. One more, take your breath. And what's happening in your body? And then and relax. And then to include pelvic floor, this is where we have to get, we want to and we need to get the full range of movement in the pelvic floor. So we do want to let it lengthen, but we also want to engage. Now, a lot of people hypertonic, over tight in the pelvic floor, can't relax it. So child's pose and lying down and letting the legs out is a really good way to then visualize and think it 1, 2, and 3. And then how I teach pelvic floor is you're basically going to very gently, and this is all the basic level, and you're just going to gently, first of all, squeeze as if you're holding a really gentle close, as if you're holding in a fart, okay? Then relax it. Then again, you're going to hold, and you're going to hold in a fart, and it's as if you're then gently holding in a wee as well. And then just relax them, let them go. How does that feel? Can you feel a close? Can you then feel it releasing and letting go? So again, you put it together, and it's gently hold, and it's as if the coccyx are coming towards the pubic bone. So it's as if it's going gentle squeeze and they're closing in. So that's a shortening of the muscles, okay, when you start that. And then you're just going to visualize as if that pelvic floor, which is like that. So that's the coccyx, that's the pubic bone, and you're going to do, for closure and engagement, you gently squeeze the posterior around hold the fart, hold the wee, they feel like they're coming in, exhale, lift. And that's when then we breathe, and we go back to this breathing thinking and getting the lengthening through this pelvic floor. So try it sitting, close your eyes, hands on, wherever you feel more comfortable of the breathing, okay? The most important, if you know you're very tight around here, then we need to get massage going and get releasing around these intercostal muscles and under here and around the back. And often it's worth going to get a massage and get people to actually properly release you. So try this lying down. So I'm going to get quite close so you can see what's happening. And again, if you need to relax, and doing this for relaxation, let your legs drop out to the side, because very easy. So I just let the legs drop out like so, okay? So they're dropped out, and that's me comfortable. You might not feel it comfortable, whatever. Hands on. So I want you to get the hands on the rib cage. That's my rib cage. That's me, just my lower part of the abs. Maybe I'll do it that way around, okay? So exactly as I've just shown to you and explained, you're thinking, we're not doing shoulders, you're not doing belly. It's just relax, close your eyes, and just visualize lovely oxygen coming in here first. So you take your breath. Make sure that, that's moving up there first. Then you feel a bit of a breath there. And then just let go and relax. So this is just relaxation breathing. So you breathe, rib cage first. Then tummy, and feel some just palpating, little tapping here will just get you to remember to send that breath. Try and visualize sending it down to here and release, let it all go. So one more of those, and it's and release. So now, when we're thinking about actually including engagement of the pelvic floor, with this, I want you to, when you're taking the breath, your breath here, here, and then down to here, think about it's almost like a lotus flower, just gently, really gently, slowly opening, okay? And then this time we're going to include the close, and lift, gentle lift of the pelvic floor muscles, okay? So, get in your comfortable position, open the legs if you feel comfortable, And it's just take your breath into the rib cage for 1, then down to here, and then I wait for a second, and I'm going to gently squeeze posterior, anterior, really gently, and now I'm exhaling, and as if I'm lifting the pelvic floor up on the exhale. Now I release and let it all go, relax, and then I repeat. Again, it's breath, visualize the breath coming into the diaphragm expands, the tummy then gently expands, and the pelvic floor muscles gently expand. Then wait for a second, don't just quickly exhale, and then you're just going to gently hold the fart, hold the wee, feel that gentle closure, nice hearty exhale, and you gently lift. But then let it all go and relax afterwards. So that's just really you getting into thinking about it. The more you can visualize. Sometimes people say it's like a balloon, opening the balloon, the air's coming in, and then you let it all go and it comes out again. So the more you can visualize and think about that, the more beneficial it will be. Try it out, try it just the relaxation, start with 1, 2, and then 3, and then put it all together. And then if you need to work more on your engaging pelvic floor, you just do very gently. Don't try and yank. It's not it's just everything. Relax and breathe. Relax and breathe. Close the eyes. Relax the jaw. Relax the jaw. All of it helps just to relax your body, and give that a go.